Well, good morning. I'm going to start with a story. A 35-year-old mother of two presents to our emergency room with an acute appendicitis. She goes to the OR for an appendectomy, and before the surgeon does the surgery, he gives a dose of surgical antibiotic prophylaxis, appropriately so, to prevent infection. She does fine. At discharge, he hands her a prescription for 10 days of antibiotics, just in case there's an infection. Day 3, she develops diarrhea. Day 7, the diarrhea becomes severe. She now has a fever, abdominal distension, severe abdominal pain. She comes back to the emergency room. She's diagnosed with toxic megacolon. That's caused by a bacteria called Clostridium difficile, C. diff diarrhea. It's a surgical emergency. She's taken back to the OR, and unfortunately, while they're removing her colon, she dies. Death from diarrhea? Is it possible? Yes, every antibiotic has the known adverse event of C. diff diarrhea. You see, this was preventable because the 10-day course of antibiotics was actually unnecessary. It was given just in case. In 1942, Sir Alexander Fleming discovered the first antibiotic called penicillin, a life-saving miracle drug. But he forewarned, if we misuse, overuse, abuse, or prescribe antibiotics just in case, the bacteria will begin to mutate. They will become stronger than the antibiotics, and they will create superbugs. Superbugs are bacteria that have developed resistance to antibiotics, multiple antibiotics, or all antibiotics. You see, when you take an antibiotic, it kills the susceptible bacteria and leaves behind the mutant. And they multiply, and pretty soon you have a superbug. The Centers for Disease Control released the threat report in 2013, helping healthcare providers learn the urgent spread of these superbugs. Methicillin-resistant Staph aureus, or MRSA, drug-resistant tuberculosis, C. diff, just to name a few. The global death rate from superbugs currently is 700,000 people around the world. That's 7 football stadiums of death. The UK hired a world economist, Jim O'Neill, to forecast for us if we stay the ground and don't change anything and continue to prescribe antibiotics and use them the way we're currently using them, what would be the worldwide death rate in 2050? And what he found and forecast, it's 10 million people, more than cancer and traffic accidents combined. So I can give you a lot of statistics, but this topic is very up close and personal to me. I've practiced as an infectious disease clinical pharmacist for over 30 years, and I've had the wonderful opportunity to travel globally and work in hospitals with healthcare providers, teaching responsible use of antibiotics and teaching to change the behavior of the just-in-case prescribing of antibiotics. What I've learned is the world is one. Ebola taught us every superbug is a plane ride away. So maybe it was in 2009 when I went to Brazil and met this headline. A 20-year-old, perfectly healthy young lady, beautiful model in Brazil, acquired her first urinary tract infection. No big deal. A couple days of Cipro, that should take care of it. And that's exactly what her doctor did. But her UTI was caused by a superbug that was resistant to Cipro and every antibiotic on the market. And she died from her first urinary tract infection as a 20-year-old woman. Maybe it's Vietnam, where I went there and saw severe overcrowding of the hospitals. So overcrowded, there's actually 2 patients per bed, spreading the superbug from one to the next. Or maybe it's India, where I go to the market and observe Any antibiotic can be bought over the counter by anyone for anything, even the common cold, which is caused by a virus. Antibiotics only work against bacteria. Or maybe it was Africa, where the poorest of poor walk for miles when they have an infection to see their doctor, only to arrive at the clinic or hospital and be told, we have no antibiotics, there's no money to buy them in the hospital. Or maybe it's right here in Columbus, Ohio, where we see superbugs in our patients every day. You see the misuse, the overuse, the abuse, and the just-in-case prescribing globally has created superbugs all over the world. Antibiotics are such a unique drug. The more we use them, the less effective they become. They are societal drugs. If you misuse an antibiotic because you feel a cold coming on and you beg your doctor to give you a Z-Pak, and you actually don't need it because that's a virus, you can create a superbug, and you can spread that to someone not even on an antibiotic. So they are a societal drug that we all must take care of. Maybe you're the 25-year-old pregnant with your first child and you have to have a C-section. Without an effective antibiotic prophylactically before they make that incision, you have a 1 in 100 chance of dying from your C-section. Maybe you're Bo Jackson, famous football player, career-ending hip injury, needed to get a hip replacement. Without an effective antibiotic to give prior to the incision, that surgical procedure, you have a 1 in 6 chance of dying from it. Maybe you are the insulin-dependent diabetic with an external pump or a hemodialysis patient with a shunt. Those external devices put you at high risk of acquiring a superbug. Maybe it's your father or your grandfather in the hospital. Did you know 33% of antibiotics prescribed by doctors in the hospital have an error? They're either the wrong dose, the wrong duration, or they're actually the wrong drug. It's not the right antibiotic. In the clinic, the outpatient setting, 30% of antibiotics prescribed by doctors in the outpatient setting are actually unnecessary. They are prescribed just in case. If you get admitted to a U.S. hospital, the Centers for Disease Control just issued this report. You have a 1 in 7 chance of acquiring a superbug while you're in the hospital. We give it to you. If it's a long-term care facility, it's a 1 in 4 chance. This impacts all of us. The answer, what can we do? It's called antibiotic stewardship. Stewardship is overseeing something worth protecting, and that something is called an antibiotic. They are miracle, life-saving drugs when they're prescribed appropriately. So, let's go through some scenarios. If you're the consumer, you're the patient, or you are the healthcare provider. You go to your doctor as a consumer without stewardship. Doctor, I feel a cold coming on. I need a Z-Pak. And you pressure them to prescribe it. With stewardship, doctor, I feel a cold coming on. What do you think you could give me for these symptoms? Maybe you're pumping gas at Giant Eagle, and you see this sign. Free antibiotics, limited time only. Without stewardship, you just pump your gas. But with stewardship, you go in and talk to that store manager. This sends the wrong message. This is irresponsible advertising. You see, I'm concerned about C. diff and superbugs. I am an antibiotic steward. You go to a restaurant. You order a steak. Without stewardship, you eat your steak. With stewardship, you ask the waitress, do you serve antibiotic-free meat here? It's important to me. You see, I'm concerned about C. diff and superbugs. I am an antibiotic steward. Or maybe you are the patient in the hospital and your healthcare team comes in to examine you. Without stewardship, you smile at them. With stewardship, you ask your healthcare providers, did you all wash your hands before you examine me? You see, I'm concerned about C. diff or superbugs. I am an antibiotic steward. Or you are the healthcare provider. You are the doctor, the nurse, or the pharmacist prescribing the antibiotic. Do you remember when smoking was considered macho, Marlboro Man, even glamorous, until we learned it actually kills you? Well, as a healthcare provider, when you go to prescribe an antibiotic, if it's unnecessary, it's just in case, it can actually kill you. So I'm going to finish with a story, a personal story. My daughter broke her nose playing sports in college. Surgeon repairs it. I go to meet him, and he hands me 2 prescriptions, one for pain medicine and a prescription for a 10-day course of antibiotics. I asked him, did you infect my daughter during surgery? He said, oh no, she got a dose of surgical prophylaxis, but we give this just in case an infection develops. So I handed it back to him. I said, how about if we think of this? I will monitor my daughter for signs and symptoms of infection. I'll take her temperature. I'll look for signs of erythema around her nose, escalating pain, and I will be the first to call you. You see, I'm really concerned about C. diff or superbugs. I am an antibiotic steward, and I hope you will be too. Thank you.